Welcome to Tuesday's edition of the Daily Report. I'm Min Sun-hee. Our path out of the pandemic and into a new normal is indeed being laid out, and we have details on that path in today's broadcast. We start now with the global pandemic updates with our Kwon So-ah. So let's begin with the COVID-19 related numbers for Korea then.
All right, Sunny, there's been a slight increase in infections compared to Monday, around 80 cases, and 1,266 is the number we're seeing as of 12 a.m. With 20 imported cases, the rest of them are domestic transmissions. Now, although it is not a huge jump compared to yesterday, if we compare the figure to last Tuesday, it is an on-week increase by almost 200 infections. And with that, the daily average number of domestic transmissions has gone slightly up to 1,386. And if we count in imported cases, this number stands at a little above 1,400. Now, by region, compared to yesterday, there has been a decline in some parts of the capital region, including in Seoul and Incheon, but an increase in Gyeonggi-do province. Now, most other places are seeing double-digit figures of infections, with all 17 provinces or major cities reporting at least a single-digit number of new cases. With that, Korea has a total number of 354,355 infections, and 15 additional fatalities have brought the death toll to 2,788. Let's move over to our vaccination updates here. 79.5% of the nation's population has received at least one dose of COVID-19 vaccine, and 70.9% are fully vaccinated. Let's take a look at the global figures now. An increase by a little over 390,000 new COVID-19 infections in the past day, with a little over 6,400 new fatalities. If we go over to some specific countries here, the U.S. at 46.4 million infections is seeing a decline in recent days. The average number of daily cases in the past week stands at around 73,000, but deaths there are on the increase recently. Meanwhile, Spain, with around 4,500 new cases, has become the 10th country in the world to hit the 5 million mark in total COVID-19 infections. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, authorities here have shared the gist of their action plan into a new normal, and we give you a glimpse of that blueprint before delving into the details here in the studio. Here's Kim Yeon-sung.
The Living with COVID-19 plan, unveiled by South Korea's health authorities on Monday, involves 3 phases and stretches into next January. The first phase is going to start by easing restrictions on small and local businesses. The next will allow for larger events. The third and final stage will be to lift caps on all social gatherings. But before moving on to each stage, there's going to be a 6-week period where health officials look at the number of critical cases, deaths, and the scale of the outbreak to determine whether or not it's appropriate to move on to the next stage. If all goes as planned, the country might see an end to all restrictions by late January. The first stage will start next Monday and will start by raising the limit on social gatherings to 10 people. Authorities will also lift the 10 p.m. curfew for cafes and restaurants. There will be no cap on operation hours for singing rooms, gyms, and public baths either. But customers of those establishments will need to show proof of full vaccination or a negative PCR test to enter. Entertainment facilities like nightclubs still have to close at midnight, on top of asking for vaccine passes. While many business owners were happy about the changes, some were divided about the fairness of the new rules.
Cafes and restaurant owners are welcoming the end of limits on their business hours, but some people running entertainment facilities aren't thrilled about the midnight limit.
A lot of people who run singing rooms and gyms say the vaccine pass isn't fair. Why can't only fully vaccinated people use our establishments when pubs can have people who are unvaccinated?
Health experts are also concerned about a potential surge in infections that this plan may bring. But they still say that this is a step in the right direction. And to make living with COVID-19 sustainable for medical staff, mild cases of the virus will now be treated at home.
It's true that this approach could be somewhat riskier, but if there's a surge in cases, we will not be able to handle it with our current system.
He says that increased at-home recovery is a critical element needed before the country heads into living with COVID-19. Kim Yeon-seung, Arirang News.
Now, as Yeon-seung has shared with us through her report, the bare bones of our plan out of the pandemic, they have been laid out, of course. And for a bit more on those efforts, I have Choi Min-jung here in the studio. Min-jung, welcome.
Thank you for having me.
Right then, Min-jung, so what are some of the immediate changes that we will start to see next week?
Right, so starting November 1st, South Korea will kick off phase 1 of its 3-step transition. As part of that, there is a big change in the number of people allowed for social gatherings. A maximum of 10 people can gather, regardless of the number of people vaccinated. But in restaurants and cafes, no more than 4 unvaccinated people are allowed. The restrictions on operating hours for almost all businesses will also be lifted as well. This means restaurants and cafes can operate for 24 hours a day, but there are still limits in places for high-risk venues like bars and nightclubs. They will have to close at midnight, and a vaccine pass for fully vaccinated people will be required for entry into these venues as well. In regards to this, the Prime Minister stressed that those who haven't been vaccinated should not be discriminated against.
We are well aware that this measure should not be used to discriminate the unvaccinated or give disadvantages to those who could not receive the jab due to health issues. We will thoroughly listen to various opinions and design and operate measures in a balanced way, promoting the daily recovery of the entire community.
The Prime Minister also highlighted that daily tallies have fallen to levels witnessed in the beginning of the 4th wave as the country heads towards vaccinating 80% of the population.
Right. So, Min-jung, a total of 10 people can gather socially regardless of their vaccination status. But if they go to a restaurant or cafe, then from the 10, at least 6 need to be inoculated then.
Right, that's right. So in order to meet for 10 people, with whether or not they can be vaccinated, they can meet at homes or in outdoor facilities.
Right, so if you're meeting at the park or if I'm having a party at home, then I can have 10 people regardless of their vaccination status.
Right, that's right.
Right. What about people younger than 18? What happens to them? Because they've just started their vaccination process.
Right, so people who are under the age of 18 or those who cannot get vaccinated due to health issues, they will be exempt from the vaccine pass measures. So they will be able to use singing rooms, public baths or fitness centers freely without the pass.
Right, so my daughter who's 17 can go to the gym regardless of her vaccination status because she's under 18 then.
Right, that's right.
Right, okay. And going back to inoculation efforts, Min-jung, I hear the Global Health Body had a few words to share with regard to that effort on the global front.
Right, so the WHO chief said that vaccinating 40% of the population in all countries will be possible by the end of the year, though he did express concerns over vaccine inequity, as many people in the developing world have not yet received their first doses. A fair distribution seems important at this point to get the entire world back to normal.
All right, Min-jung, thank you for now, but stay with us for the extended talk.
Thank you.
Right now, it's time now to get a check on the latest government remarks with regard to the COVID-19 situation here in the country. And I have Swa back at the desk with me for details on that now. So I understand we're starting with some good news on the vaccine supply front.
Right, Sunny. The government announced this Tuesday that Moderna vaccines manufactured by Korea's pharmaceutical giant Samsung Biologics will soon be supplied here in the nation. Here's the announcement made by the second Vice Health Minister, Gov't, earlier this morning.
The first batch of 2,435,000 Moderna vaccine doses, manufactured under contract by Samsung Biologics, is scheduled to be distributed in the country sometime this week. Also, Samsung Biologics earned full certification from the Ministry of Food and Drug Safety on Monday regarding its manufacturing process and quality control. Based on these latest developments and upon request from the KDCA, the ministry granted emergency use authorization for the use of these vaccines.
More specifically, the firm had to obtain the Good Manufacturing Practices certification and product approval from the Drug Ministry. Samsung Biologics had recently started mass production of the mRNA-based COVID-19 vaccine for commercial use and eventually also expected for overseas shipment. On the heels of a contract made with the U.S. biotech firm back in May during a state trip by President Moon Jae-in. Following SK Bioscience's manufacturing manufacturing of AstraZeneca vaccines, Moderna is now the second one to make and use at home. Korea also produces vaccines for Novavax and Sputnik V. Officials say not only will Korea's domestic vaccine supply be given a boost, but also it is in line with the country aiming to become a global vaccine hub.
Right. Now, Soa, who will be subject for these Moderna vaccines?
Well, a variety of people will be subject to these Moderna vaccines. According to officials today, they said that it's going to be those receiving their second shot of Moderna vaccines, and also for people getting their additional or booster shots that are at high risk of infection. However, the officials mentioned that they will make a further announcement regarding details later this week.
Right. Now the supply seems to be sufficient then, for the time being, that is, Soa. Is our vaccination process moving as smoothly, do you think?
Well, I think it is moving smoothly as well. And also that question has been raised at the earlier government briefing by reporters earlier, with the second vice health minister stressing that the next goal, which would be fully vaccinating 80% of the nation's people, is achievable and must be achieved so that we can smoothly transition into the living with the COVID-19 strategy. Let's take a listen.
We've now vaccinated around 79.5% of our population with at least one dose. Among them, as far as we know, people who won't be getting their second doses account for less than 1%, or around 0.7% to be exact. Given the progress in our ongoing vaccination campaign, we're confident of fully vaccinating at least 80% of the nation's people.
Right, and before we move on to our broader talk, so one final question. What is the government's latest assessment of the COVID-19 situation here?
Sunny, although we are still seeing more than 1,000 daily COVID-19 infections, health officials have observed another weekly decline. In the span between October 17th and the 23rd, there has been a drop by 14.3% of infections, with both the capital region as well as the non-capital regions seeing a clear declining trend. And with that, cases have been going down for the third straight week. And comparing the figure to the last week of September, which so far is the peak of the fourth wave, a drop by 46% has been recorded. The reproduction rate of the virus stands at below 1 for 3 weeks as well, at 0.88. Now, movement across the nation, however, rose by 3.7%, attributed to higher vaccination rates and anticipation towards the gradual return to pre-pandemic lives. Meanwhile, the number of people in serious or critical condition has dropped by 25 to 343 people, while 101 have lost their lives in the past week. Now, when it comes to medical capacity, meanwhile, it is stable, with 57.7% of hospital beds for critically ill patients available as of this Tuesday. In regards to treatment of COVID-19 patients, once we shift to the living with the virus scheme, an official had this to say.
According to our hospital bed occupancy data, 1.6 to 2% are patients in critical condition. Those with moderate illnesses account for 20 to 23%. That means the remaining 70 to 75% are people with mild or no symptoms being cared for at residential treatment centers. If home treatment is expanded, we may see fewer patients being treated under quarantine at these centers.
Right, and hopefully that will be just one of the many changes we'll see in the coming weeks then. Right, now having covered Korea's exit strategy in relative detail, let's now take a look at similar strategies elsewhere. And for that, I understand, Min Jung, you'll be sharing with us efforts over in Portugal, which is a country that we have yet to cover here in the studio, right?
Right, so right now many are keeping a close eye on Portugal. The country lifted many of its COVID-19 restrictions in a move to return to normality. Nightlife venues reopened and operating hours restrictions were lifted for businesses. They've seen thousands of soccer fans enjoying games with a 30% capacity limit on sports stadiums now lifted. Despite the easing of restrictions, the country did not see a surge in new infections. Experts say this is mainly due to its high vaccination rate, as nearly 87% of the population have been fully vaccinated. Restrictions are also being lifted in Japan, where cases are starting to drop. People in Tokyo may now eat and drink at restaurants and bars late into the evening. Up until last week, dining establishments had to close early and could not serve alcohol past 8 p.m. But it's important to remember that cases can always rebound once Korea begins to ease restrictions. Countries that did so relatively early compared to the rest of the world, like the UK and Singapore, are seeing fresh surges. All the more reason to stay on our toes.
Right, to stay vigilant, Minjung, I would have to agree with you. Now, so we talked about Moderna vaccines that have been manufactured here in the country, soon to be distributed nationwide. While over the US, the efficacy of the Moderna vaccine on children as young as 6, I understand, has been witnessed.
Right, Sunny. Yes, the company Moderna says that its COVID-19 vaccine is safe and effective for children aged 6 to 11, but when receiving 2 half doses. And this is based on clinical trials involving more than 4,700 kids in that age group. Now, there were some side effects observed, though, mild to moderate side effects, which include fatigue, fever, headache, pain in the arms, so the injection point. But that should sound similar to us because it is the similar side effects we have been hearing that we adults are also dealing with. Now, meanwhile, in China, this country is even looking for even younger kids to be inoculated soon. Can you guys guess which age China is looking at here?
3 months?
Three. Oh, the number was correct, but not 3 months, 3 years. So that is pretty young, and they have earlier already approved their Sinovac vaccine for younger children. But now they are looking, at least 5 local provinces have been issued notices that kids aged 3 to 11 should be soon vaccinated. And this is because the country, as I mentioned yesterday, is seeing resurgences in infections, and China has its zero COVID-19 tolerance policy. So in line with that, they are looking to even vaccinate those younger kids.
Right. They also have the Winter Olympics coming up soon.
Exactly.
Like
that's also one reason for why they are being so vigilant at this point.
Right. All right. So as always, thank you very much for that. I'll see you on Wednesday. And Minjung, thank you. See you Wednesday.
Thank you.
Korea's economy marked further growth in the third quarter, but the expansion was marginal. Our Min Soo-kyun reports.
South Korea's economy grew 0.3% on quarter during the July to September period, according to the Bank of Korea on Tuesday. While the country's economy has grown for 5 straight quarters since the third quarter of last year, the 0.3% growth is in fact a slowdown from the gains recorded in the previous quarters. The central bank said that the slow growth was due to sluggish investments and spending amid the 4th wave of the pandemic. Investment in facilities and construction dipped between 2 to 3%, while private consumption dropped 0.3% as the service sector continues to struggle with pandemic-induced downturns.
The 0.3% growth was due to a decrease in private consumption due to the resurgence of COVID-19 cases. Also, supply chain disruptions in auto chips and supply constraints in construction items were additional factors.
Meanwhile, exports remained strong, increasing by 1.5%, led by shipments of coal and petroleum products, driving the quarterly growth up. However, the latest 0.3% growth casts a shadow over the 4% economic growth outlook for this year. Earlier, the BOK set a 4% growth target for 2021, saying that the target rate can be achieved if the economy expands by more than 0.6% on quarter in both the third and fourth quarters. But since the third quarter's figure was only half of what was expected at 0.3%, industry watchers will be keeping a close eye on the economic growth in the October to December period. Min Soo-kyun, Arirang News.
Also on the local front, as part of efforts to ease the burden of surging global oil prices on the public, the government here is poised to temporarily cut fuel taxes by a record 20% starting mid-November. Our Lee Kyung-eun has more.
Amid soaring oil prices, the South Korean government and the ruling Democratic Party have announced a plan to temporarily cut fuel taxes by a record 20%. That's the largest cut ever seen in the country's history. The measure will take effect from November 12th to April 30th, so for 6 months in total. And gasoline, diesel, and liquefied petroleum gas, or LPG, will be subject to the tax cut. They will bring down the prices of gasoline by 164 Korean won, roughly 14 cents per liter, diesel by 10 cents, and LPG by 3 cents. Based on average gas prices in the third week of October, consumers can pay 9 to 10% less per liter. Those who drive roughly 40 kilometers each day could save up to 20,000 won, or roughly $17 each month. Over the 6-month period, the measure could remove more than $2 billion of economic burden from people's shoulders. The tax cut is larger than the 15% first reviewed by the government, which is by far the biggest one in record. The decision comes amid mounting global price pressures, with South Korea's oil prices hitting the highest level in 7 years at 1,700 Korean won, or $1.45 per liter.
In our case, the price pressures are still lower than in advanced countries, but since it is directly related to people's lives, we cannot neglect the issue at any time.
Over the same period, the government also agreed to impose zero tariffs on liquefied natural gas, or LNG, down from the current 2%. But considering the distribution time required, it will take some 2 weeks before consumers actually feel the change. Lee Kyung-eun, Arirang News.
And authorities have announced stern measures to rein in household debt. According to Finance Minister Hong Nam-gi on Tuesday, regulations governing mortgage loans will be toughened through broader application of the debt service ratio. Now, the debt service ratio limits the amount of money people can borrow based on their income. At present, the ratio applies to loans of over 600 million won, or some $515,000. But starting January, it will be applied to loans over 200 million won, about $170,000. President Moon Jae-in is attending an online summit on this Tuesday afternoon with his counterparts at the Association of Southeast Asian Nations. According to the Blue House, President Moon is addressing ways to better tackle the pandemic and to boost collaboration for an inclusive and sustainable future. The summit itself is also expected to provide Korea with the chance to strengthen strategic ties with the 10 ASEAN member states who are key partners in Seoul's new Southern policy.
Let's take a look at what's going on in the world now. For the second day in a row, fierce storms ravaged southern Italy on Monday, killing at least 1 person while triggering landslides and leaving roads and fields flooded. According to emergency services, the body of a 67-year-old man was recovered from a citrus grove far from where he was last seen after his car got hit by rising waters and mud. Authorities say his wife is still missing. According to the country's weather officials, parts of Sicily and Calabria were slammed by a rare Mediterranean hurricane known as Medicane, with winds of up to 120 kilometers per hour predicted. On Sunday, as much as 300 millimeters of rain fell near Catania in just a span of few hours, nearly half of the average annual rainfall on the Mediterranean island. The strong hurricane prompted schools to be closed in a number of towns and cities, while dozens of flights were diverted from the area, with ferry links between the southern islands forced to be cancelled. Speaking to the British Parliament on Monday, Facebook whistleblower Frances Haugen says Facebook will fuel more episodes of violent unrest around the world due to the way its algorithms are designed to promote divisive content.
One of the things that happens in aggregate is the algorithms take people who have very mainstream interests and they push them towards extreme interests. You can be someone center left and you'll get pushed to radical left. You can be center right, you'll get pushed to radical right.
The former product manager on Facebook's civic misinformation team said the social media giant saw safety as a cost center, lionizing a startup culture where cutting corners was a good thing, while it was making hate worse. Her comments come as Facebook CEO Mark Zuckerberg earlier this month slammed accusations that the company deliberately pushes content that makes people angry for profit, calling it illogical. Documents released to the U.S. Securities and Exchange Commission and the Congress by Hagen showed that Facebook hadn't hired enough workers who possessed both the language skills and knowledge of local events needed to identify questionable posts from users in a number of developing countries, alleging such actions amplify extremely divisive and polarizing content. Nigeria became the first African country on Monday to launch a digital currency known as the e-Naira. The country's leaders say the move will expand access to banking, enable more remittances, and could grow the economy by billions of dollars. However, both experts and cryptocurrency users in the country say there are more questions than answers regarding the digital currency, noting that a large amount of worry stems over the consistency of its central bank's rules, meaning the government now faces a tough path to make the e-Naira a success. So far, $487,000 in e-Naira have been issued to financial institutions. Nigeria now joins the Bahamas, who are the first to launch a general-purpose central bank digital currency known as the sand dollar. However, China currently has ongoing trials, while Switzerland and the Bank of France have announced Europe's first cross-border experiment. Lee Seung-jae, Arirang News.
Former President Roh Tae-woo has passed away on this Tuesday afternoon here in Korea from what appeared to be natural causes. Now, details of his passing will be shared with you later on during our news broadcasts. Moving on then, back in April this year, Tenafly, a borough in the U.S. state of New Jersey, designated October 21st as Korean Hanbok Day. Now, this is precisely the day we here in Korea commemorate our traditional attire. So for more on this designation overseas, I have Claire Lim at the Asian American Youth Council live on the line. Claire, hello.
Hi, Sunny. Thanks. I'm glad to be here today.
Right, thank you for making the time, Claire. Now, Claire, let's begin with the actual event last Thursday to commemorate Tenafly's first Korean Hanbok Day, which essentially is the first official celebration of this special day outside of the country, Claire.
So for the event, it went pretty well. I performed as the MC, and we had around 400 people show up for the first Korean Hanbok Day event. We had some congratulatory messages from politicians, a fashion show, and a Korean traditional wedding of Mayor Mark Sina. We even had time for Gangang Sule with Master Jinsuk Choi, where everyone held hands together and circled around the park in the form of the Korean flag. And to me, the most memorable part of the event was the statewide proclamation the First Lady of New Jersey, Tammy Murphy, brought to designate October 21st as Korean Hanbok Day.
Right. Now, Claire, take us a few steps back and tell us how this day was designated by officials there.
So at the beginning of the year, there were some Chinese YouTubers who claimed Hanbok was Chinese, and Hanbok was also seen in some Chinese traditional dramas. And since history is passed down through involvement from politicians and not YouTubers, we sent letters to politicians around us. And out of all of them, Tenafly Mayor Mark Sina responded first. And so on April 4th, 2021, the first Hanbok Day was proclaimed. And after that, in Closter, the second Hanbok Day was proclaimed. And when we had our first Korean Hanbok Day event, October 21st became known as Korean Hanbok Day all throughout New Jersey.
Right, so your council has played a pivotal part in raising better awareness of Korean culture, Hanbok that is. So staying with your council then, Claire, do tell us a bit about it. When and how was it established?
So in September of 2017, there was a teacher at a New Jersey high school that said, "I hate Koreans" 6 times during class. And so the school actually tried to cover this incident up. However, Brian John started a petition and gathered 1,500 signatures and delivered it to the Board of Education's monthly meetings. And so the day after that, the teacher was dismissed from the school. Due to this incident, Brian John founded the Asian American Youth Council due to concerns that second-generation Koreans wouldn't be able to speak up. And AYC originally started with 50 members from around 30 different high schools in New York and New Jersey. Currently, we have original members who have entered college in about 5 different states, and we even have members in Korea and New Zealand. AYC works for Korean diaspora's public diplomacy and the increase of political power of second-generation Koreans.
Claire, I understand your council also played a significant part in rectifying false information online about Korea's kimchi. Could you tell us more?
So at the beginning of the year, when you searched origin of kimchi on Google, it stated China and showed the Chinese flag. And so AYC had a meeting and decided on a certain time. And through social media, we had about 1,000 American users send feedback on Google at the same time. And so after an hour and 30 minutes, it was changed back to Korea.
I see. Also, back in August, Claire, I believe your council held a flag-raising ceremony in Manhattan, New York, to mark Korea's 76th Liberation Day. Tell us about that.
So in July, AYC founder Brian and other members visited Korea, and there at a temple called Jingwansa, they learned about Chor Snim, an independence activist who protected the Korean flag during the Japanese colonial era. And so after that, Brian proposed to raise the Korean flag in the United States in gratitude for the activist. And so after meeting together, we decided to raise the flag at Bowling Green Park in Manhattan, New York. This is where the last British flag was lowered in New York after the United States gained independence from Britain in 1783, and the first American flag with 13 stars was raised. It is a symbolic place to commemorate independence, so there the taegukgi was raised for a week on Liberation Day to commemorate the independence of Korea.
I see. Claire, much of your council's activities appears to be centered on raising awareness about history and culture. What more can you tell us about the motivations behind your council's campaign, and perhaps a few words on your future plans?
So when our founder, Brian John, was working with politicians, they said to him, unite together and don't lose your own identity and language. That would be your weapon and power. And so 3 years ago, when I became an AYC member, I wasn't entirely sure why we had to help politicians. However, while working with AYC for the past few years, I understood how the relationship we formed led to the first Korean Hanbok Day. And every member probably went through the same process as I did. After around 1 or 2 years, it's easy for every member to understand why we do this work. And so AYC is growing at a very fast pace. Through our motivation and dedication, our voices could be heard.
Right, I see. All right, Claire, thank you very much for making the time to share with us your efforts, and best of luck in your future endeavors.
Thank you so much.
Details have been disclosed about the initial guidelines to our path out of the pandemic. And for more on these efforts to transition into a new normal, I have Professor Chung Ki-seok from Hallym University. It's a pleasure to see you again, Professor Chung.
Good afternoon, Sunny.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. It's good to see you again, Dr. Kim.
Good afternoon.
Professor Chung, we'll start with you then. Korea has fully inoculated 70% of its population. That milestone was reached this past weekend, and it came after 8 months. What is your assessment of our inoculation drive?
Well, finally we achieved 70% of our people get vaccinated fully. And there are many countries behind us, like United States, UK, French, Germany, even Japan. That's all because of, first of all, government has done a lot, but mainly because of our people's compliance with vaccine. Because vaccination rate, for instance, for influenza is #1 in Asian Pacific region. The Koreans are very eager to get vaccinated, maybe top 10 globally. So that's the main reason why we have achieved one. But we have to remember that 70% means does not necessarily have all 70% people have immunity, because theoretically we should multiply by 80%. So 70% by 80% means 56%. That means 1 out of 2 has immunity to a COVID-19. That's good. But we have people who are waning their immunity after getting vaccination too early in this year. So I suppose maybe less than 50% of our people will have immunity. So please be very cautious when you are all fully vaccinated or not.
Right. And Dr. Kim, despite the advances on the inoculation front, there are more than 1 million people in their 60s and above who have yet to register for their vaccines. Now, having said that, what can be done to encourage these individuals to seek vaccination?
Well, we all know very well about the some vulnerability of the people in this age group to the COVID-19. But what we always also at the same time we also just talking about just the risk and the benefit. And then in this specific age group, the benefit is just much more outweighs the risks. And then also in terms of the adverse effects, the people in this age group is experience less likely, just less adverse effects by the vaccination. So there are many just good effects by the vaccination in the case. So the effort we have to actually just emphasize is that to deliver this very just a positive effect of vaccination to this group of just people. And then probably also some incentive for vaccination just might work in the end. And then also I always try to ask this question just to everyone. Just eventually within this depending on how we actually just cope with the COVID-19 within like several years or like several years, somehow just people will just get exposed and then somehow will just acquire just immunity to this the COVID-19, the SARS-CoV-2. But then there are only two ways, whether we get the immunity after actual infection or just by vaccination. And I think just the answer is very clear, to get vaccinated.
Right, so the question is, do you want to get the immunity through being infected with the virus or through inoculation?
Exactly.
Right. Professor Chung, earlier on Monday, as we mentioned earlier on the program, authorities made public their preliminary exit plan. How do you respond to this plan?
Well, generally speaking, it has the right direction. But what I am concerning is the speed. If you speed up the easing of all restrictions, then we'll meet another big wave, because this is a winter time and we are heading for a very cold season. First of all, the first step is easing restrictions in essential facilities like cafe, restaurants, and theaters, and etc. And the next step will be planned in 6 weeks' time, and we'll be allowing mass gathering over 500 people. And the last step will be doing, hopefully, in 12 weeks' time, then there's no restriction at all. Even the private gathering will be allowed as many as possible. But we have to consider some hurdles on that, because government are hurrying up at-home treatment. But as you have seen before, already there are some accidents in treating at home. And actually, this is not treatment at home. This is standby at home until the spontaneous recovery of COVID-19, because we don't have any antiviral specific agents at hand. And the other one is emergency transfer system is not well established, because 228 local government is in charge of handling of treatment and isolation. They are not doing the same quality administration. That's the main factor in going to easing restrictions.
Professor Chung, do you suppose that our efforts to ease restrictions in the country should be focused a bit more, based a bit more on our level of inoculation? Perhaps should we be looking at a higher level of inoculation rather than 70% of the population, maybe 90%?
Well, higher the better, because you have a higher inoculation rate, you have a higher percentage of people who have immunity. but it doesn't. It should not be a strict indicator, because even though you have 90% of, let's say 84%, like in Singapore, you have increased surge of people and increased death rate in that country. So the more important factor is transition to a severe and very severe cases. Currently in Korea, the rate is a bit decreased from 2.2 or 1.5. It's September statistics. But case fatality has increased. It's increased from 0.35 to a 0.78. That's why we are seeing more dead people these days than that. For last week, we have more than 10 people that die of COVID-19 daily. So we need to consider not the percentage of completed vaccination, but case fatality and transition to a severe and very severe cases. That's the main reason we should pursue, the main parameter we should pursue. And because if we have more than, let's say, 1,000 ICU patients suffering from COVID-19, then the hospitals cannot endure that kind of situation, because we have only 8,000 adult ICU beds all over the country. If more than 10% is occupied by COVID-19, how can it treat other people suffering from cancer, neurology disease, heart disease, and etc.? Because almost all big hospitals are always occupied by severe patients in ICU. So there is no way to treat not only the COVID-19 ICU patient, but also all the other caused ICU patients. So you must be very cautious.
Right. And speaking about being cautious, Dr. Kim, starting next month, then a total of 10 people can gather socially, regardless of their vaccination status, and most restrictions on operating hours at most businesses like gyms, cafes, as Professor Chung has mentioned, have been lifted, with the exception of nightlife entertainment facilities. What are your thoughts on this ease in restrictions?
Well, I think most of the experts somehow just agree on that the case numbers will just increase. But the point is that whether we can actually just control the number of well, not just a simple case, but the number of severe COVID-19 under the level that we can just manage in our some severe patients in the, for example, like a number of ICU beds and the number of the healthcare workers. So that's the key point. But somehow this was kind of now delayed. Now it's more than 1.5 years of social restriction. Somehow the government should think about some sacrifices, mostly some sacrifices from the small business owners. So this kind of some compromise in between a vaccination rate and also just easing the some social economic burden right now.
Right. Then, Professor Chung, as Dr. Kim has mentioned, the expectation is that there will be a resurgence once restrictions are eased. Having said that, what can be done perhaps to prevent an alarming resurgence in the days ahead?
Well, everybody should be very cautious. It's kind of a festival. People are very excited about easing the COVID-19 restrictions. One day we'll get there, but if we haste the process, then we'll meet another big wave. I had a word with an old friend of mine living in Singapore, who is a pulmonologist, and he told me, actually advised me, that the main factor that Singapore failed after 84% of vaccination, they had a surge of many patients and mortality rate increased temporarily. He said to me that the Singapore eased restriction by the time 70% was completed. And they think that it was too early. This is the time we are having 70% right now. So that's another lesson. The other lesson is they have started injection too early, very early, not too early, January and February. And there are many people who have not enough antibodies by this time. So that's why they are having another resurge of COVID-19 infection. So if you look at Israel, they are very eager to do a booster injection, and they are controlling their situation not bad. And when you look at the UK, they eased all the things by July. Even they didn't get the 70%, and they don't even wear masks, and they get together very freely, and they are suffering from lots of patients, 50,000 patients every day, even though the mortality is a bit low. The Denmark, one Danish told in the broadcast that they are doing very well. But he said, vaccination is the best policy. There is no other magic bullet. So all the information get together. All we have to do is very cautious and wearing masks and get booster shots as many as possible and as widely as possible. That's the lesson we should learn from the other countries.
Right. And going back to our efforts to ease restrictions as we move into a new normal, Dr. Kim, some establishments, including nightlife establishments and singing rooms, require proof of vaccination for their customers. This is bound to cause a bit of conflict, some observers say. What are your thoughts?
Somehow, but I think at the same time, we are somehow also just now get used to the such kind of just system. For example, like in some cafes and restaurant, you are now get used to some just the pushing the some QR code for just register our just presence in that specific place. So there might be some a little bit just some conflict, but not just some tension. But I think it would be just resolved at the end. And I think this decision is a kind of a legitimate just compromise between the the vaccinated people and the unvaccinated people. And then in one side, we actually have to just respect the choices of unvaccinated people. But at the same time, we also have to protect some other people, including themselves, and also just business owners. So I think this is kind of just a legitimate compromise in between those choices.
Right. And also, Dr. Kim, starting next month, those who are asymptomatic or have mild symptoms will now be required to be treated at home. Having said that, what support framework do you propose to ensure their well-being?
Well, Normality is actually just considering some such kind of just a response to such kind of the system. But I think one of the things is some very rapid and instant just the communication, the system almost like a 24/7, and also some implementing some very fast transportation systems to the nearby just local hospitals to just cope with such situations.
Right. And Professor Jung, come Friday, authorities will share their final blueprint, exit blueprint that is. And having said that, what are some revisions that you would like to suggest to the current framework that was shared on Monday? Do we need to make any revisions?
Yeah, I actually advised to officers in government for some points yesterday. And among them, I like to emphasize the home treatment system to be more supported and to be well equipped, because government is going to allow almost all people less than aged 70, either whether they have underlying disease or not, they can stay at home. But that is not a good choice, because if you are older than 65, it's technically elderly people, and you can have underlying disease even though you cannot aware of that. So that's the case. We had 68-year-old who are known to have no underlying disease, but he died all of a sudden. People are getting to the hospital. So I recommend the age group less than 65 or 60. And if he or she had the underlying disease quite seriously, then he or she should not be stay at home. And as Dr. Kim mentioned, the emergency transportation system should be well equipped, because if you don't have that kind of system, there is no way to keep those vulnerable patients at home. It's just observation. It's not a kind of treatment. And so, and the other one is they have more than 50 pages of propaganda in their announcement. in that they are going to narrow the epidemiology investigation service, because they narrow the duration and then they narrow the population. So in that case, I'm worrying about the silent spreading of infection, because now still we don't have more than 30% of people who don't have any infection source. But in that case, maybe more hidden patients will be spreading their infection while we were enjoying easing of restrictions. So I like to recommend to strengthen the EIS service from now on, even though they keep easing the restrictions. So again, I like to mention about ICU care readiness, because if you have more than say 1,000 or 1,500 ICU patients, then the medical support will be can be threatening. So I like to mention those some points in preventing disaster.
Right. And the same question to you, Dr. Kim. What are your recommendations for possible revisions to the current plan?
This is not just a new recommendation, but this already just discussed in the meeting, the discussion meeting. And then I think it's a good idea that we can just come up with some sort of just a circuit breaker, the measure, or like in the stock market. So when some percentage of the ICU bed is just occupied, like 60% or 80%, then we can just impose such kind of some warning system or alarming system, like 60%. Then not just automatically just transition to the after 6 weeks and then after 6, but then we just monitor mostly some of the severe cases. So if there's some, and then also considering the number of just beds available in the hospital, so then we can just implementing some kind of circuit, the breaker in our sort of transitioning into some normal life.
And when should the circuit breaker be imposed, in your opinion?
I don't know about just the experts are thinking about some 60% or just 80% of just occupancy of just hospital beds, especially just severe COVID-19.
I see. Hopefully that will not be the case when we ease our restrictions.
Of course not.
All right, Dr. Kim, as always, thank you very much for your thoughts, and Professor Chung, thank you for being with us today.
Thank you.
Right, well, that's all the time we have for this edition of the Daily Report. We'll be back with more coverage on Wednesday. Join us then. Take care.